President Bola Tinubu declares Nigeria remains undaunted in addressing security challenges despite interference. Safety on waterways. Minister of Marine and Blue Economy flags off first phase of distribution of 3,500 life jackets in Bayelsa State. Nigerians strengthen health system to end cases of zero doses and meet universal health coverage targets. A warm welcome to the News Desk 3 on NTA News 24. We're reaching you live from Abuja. I am Vivian Ezadifi. Let's begin with the President's visit to Katsina State as more commendations are coming for the bold decisions and reforms of the Tinubu's administration, which are reportedly repositioning the sub-national government with more resources to facilitate development and growth at the grassroots across Nigeria. Governor Iko Rada of Katsina State appreciated the leadership of President Bola Tinubu through the economic transformation of the country. State House correspondent Musbah Danwahab reports that it was at the state banquet and presidential interactive session with Katsina elders.
Mr. President, a working visit like this does not come often from a sitting president. Katsina State, ranking highly to President Bola Tinubu, got this opportunity and maximized it to the fullest. Some state governors were equally here to compliment. And in a way, Governor Iko Rada is marking the honor with a state banquet for the president. And indeed, the president felt at home, particularly with his favorite northern artist, Rarara, on the stage. The dinner also provided opportunity for interaction with elders of the state. Traditional and political leaders, including past ones, leveraged the platform to appreciate the president for his support to one of them, former President Muhammadu Buhari, and for the appointment of many of them to key positions currently. The reforms instituted by the president were again celebrated for yielding more resources for the central and sub-national governments to work with.
Your bold decisions have really helped the sub-nationals, because without taking those bold decisions, we could not have been where we are today, that we are commissioning projects. But today, we can pay salaries and still do a lot of developmental projects in the state. Thank you for your bold decision, Your Excellency.
But then, insecurity in parts of the state still remains a major concern for them.
So governors need your support, need your empowering them to address them. Because why do I say it's local? The crime is mainly being committed by local people. So there is need, please, Mr. President, once again, we appreciate what you are doing, but support the governors to empower communities.
For the insecurity in parts of the country, the president is positive about the victory of Nigeria in the end.
We will do everything to fight terrorism and banditry. Yes, we will invest more in technology. We will take over all our forests. We must. It was never like this before in Nigeria, but we will reverse the trend.
And then, President Tinubu reassures about the recovery of the economy.
The ability of a leader to take a decision at the right time is the hallmark of leadership. We took it, we stayed with it, and it will be rewarding. It is already bearing fruit.
With the latest influx of bigwigs into the ruling party, Governor Radda says the state remains resolute in support of President Bola Tinubu's administration. From Katsina, Musbau Nanwahab, NC News.
Still from the home of hospitality, President Bola Tinubu says his administration remains sincerely committed to the various interventions and projects aimed at development of Katsina State and other parts of the northern Nigeria. The president restated this commitment as he inaugurated agricultural and infrastructural projects executed by Katsina State government. Again, State House correspondent Musbau Nanwahab reports.
Residents of Katsina put other activities on hold at this moment. The number one citizen is in town. Katsina remains one of the states that have produced some past leaders of a country. That include a political ally of the president and immediate past president, Muhammadu Buhari. For these and many reasons, President Bola Tinubu says he feels at home as he inaugurated the Agricultural Mechanization Center, which the state government is projecting to boost agriculture in the state. For these initiatives, President Tinubu commended Governor Radda for upholding the exemplary leadership traits known with past leaders who have come out of the state, including the late Umaru Musa Yar'Adua.
I want to assure the Nigerian public that agriculture in the heart of our program is a must for us. I could see many of the governors here present, dedicated and committed to food sovereignty. We, at the federal level, we are committed to all of this, and we are investing in mechanization. We face the challenge of irrigation and water management. The old style of agriculture is gone.
The president assured that his government will sustain and build on various projects aimed at transforming the region, including the Kano-Katsina Maradi rail project and agricultural projects, as he believes solution to hunger will also help in solving insecurity in the country.
What we are commissioning is effort to banish hunger, commitment to food sovereignty, great empowerment for our people, small and large-scale farmers. Once we liberate ourselves from hunger, we will appreciate peace and progress.
Governor Radda appreciated the federal government under the leadership of President Tinubu for his reforms that have increased financial allocation to the subnationals to ensure all-round development.
We have also received the support of 25 billion as a direct intervention
from the federal government under your stewardship. Sir, these are your 25 billion naira. This is what we use the money for. The mechanization center will serve 34 local governments, and we have over 400 lobo tractors that we assemble here today. Multifunctional combined harvesters, digs, harrows, and ridges, as well as 1,000 multi-planters with us today.
While promising to continue to maximize the opportunity with more commitment to developmental projects, the governor seeks more federal support, particularly in ending insecurity.
We'll continue to count on the federal government support to completely eradicate banditry and criminality in our state and the Northwest region in general, Mr. President. Sir.
President Tinubu also inaugurated a 24-kilometer Katsina Eastern Bypass dual carriageway and flyover bridge named after him. From Katsina, Musbau Dan Wahab, NC News.
So aviation matters now. The Director General Nigerian Civil Aviation Authority (NCAA), Chris Najomo, has directed airspace to immediately improve its domestic operations owing to complaints of chronic flight delays and cancellations by traveling public. The director has told the airline to trim its operations to the size of available aircraft presently in its fleet to mitigate the crisis. The DG gave the directives while meeting with some management staff of Airpeace domestic operator in Abuja. Chris Najomo says while the NCAA will continue to support the airlines, the operators must comply with the regulations and global best practices. He explained that the NCAA is increasing its monitoring of flight operations across all airlines to ensure compliance. Kogi State Government says it's on course to improve citizens' access to clean water supply. Governor Usman Ododo disclosed this when he donated a multi-million naira water drilling machine to the Rural Water Supply and Sanitation Agency. This initiative aims to boost water supply across communities in the state, particularly in rural areas where access to potable water is often limited. The governor urged the management of the agency to ensure proper maintenance of the drilling equipment and other water facilities to maximize the impact of the initiative. The Commissioner of Water Resources, Yahya Farouk, highlighted the governor's efforts since assuming office to revive water supply in the state. He noted that the ministry has achieved significant progress in supplying potable water to residents of Lokoja through a well-designed ratio system. What? The FCT Police Command says it arrested 1,611 suspected criminals in the month of April for various criminal offenses. Commissioner of Police Ajao Saka Adewale, in a press briefing, says the successes achieved are a result of extensive raids of several black spots across the territory. Onotu Yakubu brings us detail.
The highlights of achievements show that the FCT Police Command recovered a total of 21 suspected stolen vehicles, with 15 suspects arrested in connection with the various cases. Commissioner of Police Ajao Saka said the command undertook comprehensive analysis of crime patterns following rise in cases of car theft and drug-related offenses, leading to these breakthroughs.
I want to equally appeal strongly to members of the public that will continue to feel security as a collective responsibility. When music changes, the dancing step ought to change. Everybody should be concerned and be intentional about the security of not only their person, including their assets. For instance,
CP Ajao Saka further explained that through credible intelligence-led raid of IDP camp Durumi, Kuje Gudaba Tipa Garage, and black spots across Kubwa, recovered substantial quantities of assorted hard drugs, cannabis, suspected stolen mobile phones, point-of-sale POS machines, 169 ATM cards, fake currencies, and a substantial amount of cash suspected to be proceeds of crimes.
we couldn't have achieved this one alone, but for the collaboration received from other sister agencies, including the military, the DSS, NSCDC, including the hunters and the vigilantes within the FCT. It is this kind of synergy that has resulted in the achievement we are celebrating today.
The police command reiterates that these achievements reflect its unwavering commitment to ridding the FCT of crime and make it a safe place for all to live and thrive. Onotu Yakubu, NTA News.
This is the News Desk 3 on NTA News 24. More stories when we return. Welcome back. Nigerians quest to vaccinate every child irrespective of the location with the target to end cases of zero doses and meet the universal health coverage has been strengthened with the launch of about $200 million health system strengthening grants, a support project from Gavi, the Vaccine Alliance, Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pati, in a message at an event in Abuja, reaffirms Nigerians' commitment to making quality health services equitable, accessible, and affordable for every citizen. Olushe Adiabu has details.
Immunization is key in safeguarding children's health, but achieving universal vaccination coverage has been a significant global challenge. In UNICEF data, more than 12.4 million children did not receive vaccines in 2020. These vulnerable children are labeled as zero-dose children. Nigeria faces an alarming situation among these countries, with over 2.2 million estimated as zero-dose children in 2021. To address this, the federal government, with supports from development partners, is launching the Next Health Systems Strengthening Grants, which is the third phase, HSS3, a $191 million program for the next 4 years.
And now we are more committed to improving the immunization coverage for all our children.
We are also going to be using tools to make this easier, traceable, and measurable. So digitization of the immunization program is going to continue. The cold chain infrastructure will be strengthened.
While Gavi speaks on the grant's intents, responses from other key players who are implementers explain its prospects of increasing immunization coverage to 84% by 2028.
We are really focusing on the communities who are being missed. They're not just being missed by immunization, they're being missed by the health system. And by really drilling down on which are those communities, why are they being missed, what are the barriers we need to overcome.
But this is not just the accountability of the government or partners like UNICEF and Gavi. This is also the accountability of communities. It is the accountability of parents. They should know they have to take their children to be immunized.
Clear commitments and image of collective efforts is put in Nigeria on the threshold of transforming its immunization program and accelerating progress to protect every child with immunization. In Abuja, Olusheye Adiagbo, NTA News.
Still talking health, the National Hospital is celebrating the 10th anniversary of its trauma center, a first of its kind in sub-Saharan Africa. The facility has thrived through many challenges to become a leading hub in the care and treatment of patients who have suffered major injuries. Dennis Adegunloye reports.
James, not his real name, finds himself here at the burns unit of the National Trauma Center in Abuja, following a workplace accident. He narrates his ordeal and the type of care he has been receiving.
We're doing waste management, and the waste management is more of burning using our incinerator. So some of the waste got exploded, and unfortunately I was engulfed by the fire and got burnt. So I was admitted in the Alex Ekweme Federal Teaching Hospital, Abakaliki. So, but because of the circumstances surrounding my case, I was transferred to this place for a better care. So, lucky enough, I met a capable hand, both the doctors and the nurses, who were able to arrest the situation and brought me back to life and fit.
His is just one of the approximately 20,000 cases that have come before the center since inception. By law, those who have suffered major traumatic injuries, such as in traffic accidents or gunshot wounds, must be treated within 24 hours regardless of their capacity to pay. This is explained by the Chief Medical Director of the National Hospital, Professor Mohammed Raji Mahmood, is one of its major challenges, apart from overstretched staff and energy costs.
The people that come have not planned to have that trauma, accidents or burns or things like that. So it catches people unawares. So a lot of these people are people who may not be able to afford the care, and we know that care of trauma diseases very, very expensive, most especially the first few days. It can run into millions. So all this come from the purse of the National Hospital itself.
By and large, the trauma center has done a great deal in trying to alleviate the suffering, the challenges of those individuals that have been seriously injured.
Thank God for the past 10 years, we have had about 60% success rates of at least 87%, 90%, and other category of patients that we have not successfully.
The facility, which is certified as a Level 4 trauma center, also serves as a hub for main training in advanced trauma surgery and collaborative research with other centers within and outside Nigeria. Despite these challenges, staff remain dedicated to giving the best possible care to patients like James, who says without them, things might have turned out quite different. In Abuja, Dennis Adegunloye, NTA News.
And to enhance healthcare delivery in Nigeria, collaborative efforts from individuals, organizations, and government agencies remain essential for achieving quality outcomes. In a significant step towards this objective, Dr. Obe Charity Foundation, a non-governmental organization, was officially launched in Abuja with a mission to provide medical care and support to unserved communities. Aliko Manachiarua reports.
Nigerian government continues to make deliberate strides towards improving access to quality healthcare services. These efforts are being bolstered by key stakeholders and non-governmental organizations. Joining this vital cause is the Dr. Obe Charity Foundation, a non-governmental organization established to address the medical needs of vulnerable populations. The foundation formally launched with the unveiling of a book titled The Joy of Being Hurt, authored by its founder, Tosimi Obe Majesty, shared the inspiration behind both the foundation and her book, explaining that the publication delves into the complexities of human emotions and celebrates the strength that arises from resilience.
Young people, children, can give CPR overseas and save lives. We've seen 6-year-olds help their parents come back to life. While they're calling 911, they're giving chest compressions and their families have been saved. we can do this. We can make our schools, NYSC camps and everywhere a place of training and start training people for free.
Health sector stakeholders applauded the emotional depth and philosophical insights of the book.
Lots of needless deaths, that happen in our society, and anything we can do to bring that down is certainly something that is worth supporting.
She was trained in this country. She now works in the United States of America, and she's come back. It's like giving back to your community. And this is what everyone should be thinking about. If you have benefited from the country in any way, then you should give back.
The book is dedicated to Dr. Obe Majesty's late father, a pioneering figure in Nigerian healthcare sector. He was the first medical doctor from Benue State and the founder of Salem Hospital in Otukpo, in Abuja. Alika Opanachi, Arua, NTA News.
And that concludes the News Desk 3 on NTA News 24. Thanks for watching. I'm Vivian Ezadife. Enjoy the rest of the day.